Hello everyone, in this lecture we are going to talk about different types of restoration. The main objective of this lecture is that the student must have a clear concept about different types of restorations used in dentistry. This is Dr. Rashid Hassan. Let's get started. So these are the types of restorations that you will come across throughout your studies of dental materials. So it's very important to have a clear concept about each one of them. Either it's going to be direct restoration, indirect restoration, fixed restoration, inlay, onlay, crown, bridge, veneer, or a dental implant. Well, the main aim of these restorations is to restore the normal tooth function or to restore the aesthetics of the patient. So let's get started with each one of them. The direct restoration. This is the type of restoration which is prepared for immediate placement into the patient's mouth. They do not require any external fabrication, that is, they do not require any lab work. So simply you can call them as dental fillings. They require a sufficient amount of tooth structure to support a filling. As you can see here in the picture, the two very commonly used direct restorations are dental amalgam and resin composites. They are less time consuming and they are inexpensive. These are the most commonly used direct restorations in dentistry. Unlike the direct restorations, the indirect restorations are processed and fabricated outside the patient's mouth. That is, they require a dental lab to prepare and process them for the prepared tooth. They do not bind chemically with the tooth structure, that's why we have to use certain adhesives or a luting cement to adhere these indirect restorations to the prepared tooth. They are expensive as compared to the direct restorations, as well as they are time consuming as the lab has to prepare them. So it may take a couple of days for these restorations to reach back to the dental office. Gold crown and the porcelain crown are most suitable examples of the indirect restorations. Fixed restorations, fixed appliances, or you can simply call them fixed prostheses. As the name tells you, these restorations remain fixed with the natural tooth structure, and they are intended to remain in the patient's mouth for an indefinite period of time. Ideally, they should remain for indefinite period of time. For example, a dental crown or a dental bridge. But in some cases, there is a definite or specified period of time for which the fixed restorations remain into the patient's mouth. For example, in orthodontics, the orthodontic appliances, they remain fixed into the patient's mouth for some specified period of time, but then you have to remove them once the treatment is over. Removable restorations or removable prostheses, unlike the fixed ones, can be removed on regular basis from the patient's mouth. They are basically intended to perform certain specified functions into the oral cavity. Like, for example, if there are certain missing teeth, you can give a partial denture, removable partial denture to the patient. So that's also a removable prosthesis. They can be removed either by the patient himself for the cleaning purposes, like the acrylic partial denture, or they can be removed by the dentist himself for adjustment, like the removable orthodontic appliances. An inlay. Inlay is basically an indirect restoration that is made to fit into the prepared cavity. Being an indirect restoration, it means it is prepared in the dental lab. It basically restores one or more tooth surfaces and may possibly include one or more tooth cusps as well. The examples of dental inlays that we see here, either it can be metallic like gold inlay, or it can be ceramic inlay as well. An onlay. Onlay is also an indirect restoration, which means that we require a dental lab to fabricate and process an onlay. It basically replaces one or more cusps and the adjoining occlusal surfaces. Well, that's the main difference between an inlay and onlay, where in inlay the cusps are involved, but here the adjoining occlusal surfaces are also involved. Like we can see here in this picture, the gold onlay and the ceramic onlay, we can see that not only the cuspal area is involved, but the adjoining occlusal surface is also involved. A dental crown. A dental crown is an indirect restoration. That is, we require a dental lab for the fabrication and processing of a dental crown. Since the crown covers the entire tooth surface, so the patient sometimes they refer to it as a cap. The main aim of a dental crown is to improve the shape, function and appearance of the natural tooth. Like for example, in posterior teeth, where strength is more important than the appearance or aesthetics, and the crowns, they are not much visible in posterior teeth. So we use a metal crown, for example a gold crown in the posterior teeth, whereas in the anterior teeth where aesthetics is very much important, so we use a porcelain crown for anterior teeth. A dental bridge is also an indirect restoration which is used to replace one or more missing teeth. Basically, a bridge is cemented to one or more adjacent teeth which are prepared with the help of dental drill. The tooth that a bridge replaces is known as pontic, and the adjacent teeth which help in the cementation of a dental bridge are called as abutment teeth. These abutment teeth are prepared with the help of dental drill, and then we take the impression and send it to the lab, and according to the need of the patient, either we get a metal bridge or a ceramic bridge. A veneer most commonly replaces the facial aspect of the anterior teeth in order to improve the aesthetic appearance. A veneer may be fabricated indirectly in the lab, and porcelain is the material which is used for the indirect veneers, or they can be fabricated directly into the patient's mouth with the help of dental composites. A denture is a removable indirect restoration whose main function is to replace one or more missing teeth. A denture can be classified as a partial denture or a complete denture or full denture. In case of partial denture, a patient has one or more natural teeth inside the oral cavity, whereas in case of a complete denture or full denture, both the arches are completely edentulous and the patient has no single natural tooth inside the oral cavity. Partial dentures are mostly fabricated with the help of acrylic, or sometimes metals are used to fabricate the partial denture like cobalt, chromium or nickel. Whereas the complete denture, they are also made up of acrylic and sometimes acrylic and metal together. In case of partial denture, there are metal clasps which help to support or retain the denture in place, whereas in case of complete denture, the underlying bone and the supporting tissues help to keep the complete denture inside the arch. An overdenture is also an indirect prosthesis, usually a complete denture which rests either on the dental implants or the retained natural roots. A dental implant is a replacement for the roots of the natural tooth. It is basically placed within the jawbone with the help of drill. Dental implants can be fabricated from a variety of materials, for example titanium or titanium alloy. They are basically used to support either a crown or a bridge or a denture to replace one or more missing teeth. So in a nutshell, we can say that there are many types of restoration and appliances which are used to restore the masticative function and appearance of a dental patient. So it's up to the dentist to choose a specific restoration to give the best treatment to the patient, but it's not possible without knowing the specific properties of the dental material. I'm Dr. Rashid Hassan. If there is any question, you can inbox me. Thank you very much. Take care.